I can't sleep when I lay in bed. Too much thinking in my head. I don't know what to do anymore. But come on now, tell me the score. Is there anything I can do to get out of these tragic blues? I'm a victim of circumstance. I never really had a chance. I lay down and stare at my feet. You know the world has got me beat.
Hello and welcome to today's edition of Mental Health Matters. Our topic for today is mental illness. It's not always what you think, which is a project of the Sacramento County to encourage conversation on mental health issues to reduce the stigma and discrimination that people often face when they experience a mental illness. The project aims to eliminate stigma toward people living with a mental illness, as well as promote mental health and wellness, and also inspire hope for people and families who are living with mental illness every day. Let me share a few statistics on mental illness. In any given year, roughly 1 in 4 adults and 1 in 5 children will experience a serious mental illness. Here in Sacramento County, it is estimated that nearly 355,000 residents are living with a mental illness, but research shows that only 1/3 of those will actually seek help in their lifetime. Mental illness does not discriminate. It affects every racial, ethnic, economic, and religious group and impacts individuals of all ages. Stigma and discrimination can cause shame, despair, hopelessness, and ultimately prevent people from seeking help. Self-stigma prevents up to 60% of people from actually seeking any kind of services or support. Today, we're going to talk a little bit about the Sacramento Speakers Bureau, the Stop Stigma Speakers Bureau. Stopping stigma in our community will take the voices of many. The Project Speakers Bureau offers an opportunity for people living with a mental illness, their friends and family members, to share their stories that help promote positive attitudes about mental health. Today, you will be hearing from 4 speakers from the Stop Stigma Speakers Bureau, who will be sharing their personal stories of hope and recovery. The speakers today are Bill Maher, Kamika Edwards, Katie Williams, Roman Montague, and his family. These speakers are seeking to promote mental health and wellness while also trying to eliminate the stigma and discrimination for those living with a mental illness. Here are their stories. We hope you enjoy them.
My name is Bill Maher. I am living with a mental illness called agoraphobia or obsessive compulsive disorder. They sort of cross over. Obsessive compulsive disorder, a lot of people think is the hand washer or somebody who, has a way of having to keep things orderly. And really what OCD is obsession is fear and compulsion is behavior. And because somebody has this irrational fear of something, they then practice a behavior. And the reason people who have OCD do that is because it helps us to alleviate the anxiety that comes up because of that fear. And so part of the reason my OCD and agoraphobia are very similar and they sort of cross over one another is my fear is that I'm going to die of a heart attack. All of my fears, all of my obsessive thoughts are about my health. I'm always worried about being near a hospital because my fear, of course, is having a heart attack and dying, and my compulsion or my behavior that I practice is to go to the hospital. So in the last 5 or 6 years, I've been to the emergency room about 300 times. Every time I'm having chest pain or I'm getting tingling in my arm or numbness or any of those symptoms, I always think it's a heart attack. I always think worst case scenario. A lot of people, if you go out to eat breakfast or you go out to eat lunch and you eat a little bit too much and you get that little pain in your side and everybody goes, oh man, I shouldn't have eaten so much. My first thought is it's a tumor or it's something really, really bad. It's really hard for me not to have a physical symptom of some sort and not think worst case scenario with that physical symptom. So one of the things that I do as a behavior or as an avoidance, if you will, is I avoid going places where there's not a hospital nearby. Because again, my fear is that I'm gonna have a heart attack and die, so naturally I wanna do the things that keep me close to medical help. So if ever I go to a business meeting, vacation, the grocery store, I can tell you where every hospital, every Med 7 urgent care, every medical help, if you will, is within about a 100-mile radius. If we go on vacation and let's say we go to Disneyland, I want to make sure that I drive a route that allows me to be near bigger cities where I know there's going to be medical help. And then I'll get on Google Maps and of course I'll map out where all the nearest hospitals are, where all the medical clinics are, all of those things. Agoraphobia, a lot of people think agoraphobia is people who are afraid to go outside. And the reason agoraphobia crosses over with OCD in the form that I have it, in the sense of, being afraid of having a heart attack and dying, you can become agoraphobic because the disease itself gets so challenging that eventually what you do is you avoid going outside, or you avoid so many things that you're afraid are going to trigger that feeling of anxiousness and panic, that before you know it, you become a recluse and you just stay indoors. So that's why it becomes agoraphobia for me. The thing that I really want people to understand about mental illness, and we say this a lot with Stop Stigma, is mental illness is not what you think it is. People are always surprised at meeting me and me being so open and talking about my mental illness. And I don't mind talking about it, even though I will be honest and say that there are times where I do feel a little bit embarrassed or a little bit stigmatized, because you are worried about how people are going to react. Yet I'm always pleasantly surprised at when I tell clients, friends, family members, whoever it might be that I share my story with, that either they themselves have struggled with depression, anxiety, some form of mental illness, or they know somebody who struggles with it. And then that immediately puts your mind at ease because you think, okay, you're not alone. I think the biggest thing is when you first get diagnosed with a mental illness, for some reason you put that label of, oh my gosh, am I crazy? You start having all these horrible thoughts about what people might think if they find out that you're taking medication for it. I'm taking medication for this heart condition, which nobody balks at or nobody has an issue with. I really encourage folks, not that it's for everybody, but if you have a mental illness and you're worried about what people are going to think about you taking medication, it's really no different than if you're a diabetic or you have a heart condition or a skin disorder or some other thing that requires medication. I think because mental illness is invisible in a way, it's pretty hard to see inside of our head, it's pretty hard to see inside of our brain. And so unlike when you have a skin rash or you're diabetic, which deals with insulin and different things, those are very commonplace in our society. But I think because in my mind, mental illness is sort of invisible. It's a disease of the brain. And because it's so invisible, I think people have a hard time grasping it. And so I think people they don't take the disease as serious as they should, because it's not something physical that you can look at. But again, the thing I love about talking with Stop Stigma and the Speakers Bureau, and mental illness being, our main message is that mental illness is not what you think it is. I think when people meet me and they see that I look quote unquote normal, that's fine for whatever normal means, but I really don't believe that I'm the person that looks like I have a mental illness, and that I really struggle, sometimes minute by minute, hour by hour, day by day, with a disease that is really debilitating. Mental illness doesn't discriminate. It affects people of all race, all skin colors, all national origins. It doesn't really matter. And the other thing that's interesting about mental illness is I didn't choose it. It wasn't until I was about 35 that I realized that I had a severe mental illness, and I wasn't sitting around in my living room one day bored out of my mind thinking, wow, I really need to spice up my life. Maybe anxiety could be interesting, or maybe this could, really spice up my life. It chose me, I didn't choose it, and so now I have to manage it and deal with it the best I can. My background, my story of when I grew up, my mom spent half her life in prison. And so I was always going to visit my mom in prison while other kids were taking vacations with their parents and things like that. And so I've always worked really, really hard and tried to be as resilient as I could possibly be, because I don't want my family or my kids or my wife or anybody to see that dysfunction or to be a part of it. Ironically, what I didn't understand was that all that fighting over the last 20 years of trying to break that cycle of dysfunction and being resilient is what has given me the strength that I need now, so that when I have tough days of mental illness, or I'm struggling with obsessive thoughts, or I'm just struggling in general with my disease, I already know what it feels like to be resilient. I already know what it feels like to have to overcome. I see it as such a positive that I went through all of that, because those 20 years of dysfunction and trauma and very unnormal circumstances, in my opinion, are what prepared me to do this fight now, which is, battle my disease, manage it the best I can, take things one day at a time, and really realize, and this is something I think people with a mental illness forget, is that your mental illness, though it may not be curable, if you will, you can definitely manage it. And the symptoms that you feel day by day, hour by hour, minute by minute, are temporary. And one of the things I used to do, which was a mistake, and so I don't do it anymore, but I would be having a very difficult moment where I felt anxious and panicked, and the world was coming to an end and everything just felt so doom and gloom. And during those really difficult moments, I would start taking inventory of everything in my life. And unfortunately, that's not the time to do that, because what it does is it makes everything feel bigger than it really is. And so now what I do when I have those difficult moments is I continually repeat to myself that everything is temporary, and this is temporary. And then I really try and focus on being in the moment and being present and being mindful of everything around me, the color of the leaves on the tree, the noises in the backgrounds, the birds, the planes, the cars, everything I can hear. I try and focus in on that so that I can be more present, instead of being out in the what if world, or in that place and time where you're basically saying, okay, well, what if this happens, or what if that happens? And really the only thing we have is right now. And then once I get through that difficult moment, that challenging moment where I'm not panicked, I'm not anxious, I'm not fearful, I'm not thinking obsessively, when I'm in a better place, then I start taking inventory, and then it feels more genuine to me, and it feels more, it just feels more genuine, it feels more sincere to me. And what we don't realize is that we're in that panic state, that anxious state, that fearful state. It's a temporary state of mind. It's not something that you're going to be stuck in forever. So when you're having those really challenging, difficult moments, I try not to let those moments sort of dictate my future behavior. I try not to let it be the last. I don't let my anxiety get the last laugh. There's a gentleman named Jeff Bell, and Jeff Bell, I think, I know he has a radio show on, I think it's KCBS maybe, or anyways, Jeff Bell is a gentleman who I know struggles with some form of anxiety, but one of the things that he taught me a long time ago was, I call my anxiety the doubt bully, and the doubt bully constantly tries to bully me with obsessive thoughts, fear-based thoughts, a lot of these things that are anxiety-based fears. And so when the doubt bully pushes me around, I really try to refer to my anxiety, if you will, in the third person, because then I feel like it's something that I actually can have a little bit more control over, and it's not just this invisible disease, if you will, that people struggle with. So, sometimes I just have a really bad day or a bad moment, and I say, oh, the doubt bully's trying to push his weight around today or whatever, and it kind of helps me to move on. Even though I'm still worried at times what people might say or what people might think if they find out, I have clients who may at some point see this interview, or friends or family members, and if for some reason they think differently of me because I've done this or because I have a mental illness, I just don't care. To me, it's more important to give this message of hope and to help those that struggle and that don't have the support system that I have, that there is hope, there is help, there is a future. The future's very, very bright. It's more important for me to send that message and to be sincere about that, and the rest of it will take care of itself.
I would like you to imagine a precocious 9-year-old girl. She could be your daughter, granddaughter, niece, or cousin. As most young children, she enjoys visits to her grandparents' house where she joyfully plays hide and seek with her sisters and her cousins. She would be taken to this store for candy and ice cream by her favorite uncle, then eventually molested by him. She didn't think anything of it, just another example of his special affection. Years later, that 9-year-old would finally tell her family about the abuse. By their lack of response, she learns early on that her feelings don't count. She then begins a downward spiral towards drug and alcohol abuse, promiscuity, and depression. Due to her non-existent boundaries caused by being violated by a trusted family member, she becomes re-victimized in a physically and emotionally toxic relationship, a physically violent and emotionally toxic relationship for 7 turbulent years. Now imagine her sinking to the depths of despair. She gives up hope of ever feeling normal and loved. She decides to end it all by attempting suicide. After years and years of hospitalizations, medications, counseling, and faith-based support, she finally realizes that there can be life after abuse. How do I know? I was that 9-year-old girl. This is my story. My name is Kamika. I am a single mother, a teacher. I am a recent graduate from a master's program. I am a beginning piano player, a lover of all books, and a survivor of abuse. Because of trauma and other factors, I have had to learn how to live with the challenging effects of depression, anxiety, and PTSD, which is post-traumatic stress disorder. Mental illness is not always what you think. My journey from victim to survivor was not and is not easy. Some of the PTSD symptoms that I experience include nightmares, loss of sleep, jumpiness, and hypervigilance. I am very, very protective of my children. Many days I battle with worry. At times, my anxiety feels overwhelming, panicky, and paranoid, always expecting the next bad thing to happen. Trying to maintain control all the time is very exhausting. My symptoms of depression feel slow and heavy, unmotivated and lethargic, weepy and emotional. Many days I would feel numb, like a passive participant just letting life happen. Things unraveled pretty quickly. I recognized I had to deal with these symptoms instead of letting them deal with me. Eventually, I sought help for these mental health concerns. First, my faith in God has provided a foundation of hope, and without it, I wouldn't be here today. Second, individual and group counseling, along with medication, help me cope with the roller coaster of symptoms that I deal with on a daily basis. Throughout my healing process, one thing that was most comforting to me was to share my story with someone who cared enough to listen. This leads me to the topic of stigma. Well, what is stigma? According to NAMI, which is the National Alliance on Mental Illness, stigma is defined as an attempt to label a particular group as less worthy of respect than others. a mark of shame, disgrace, or disapproval that results in discrimination. When I shared what I was going through, was I treated with less worth and less respect? Was I treated with disapproval? Was I stigmatized? Yes, yes, and yes. At first, I didn't tell my story for a long time because I was angry with myself for allowing the abuse to happen. I had to realize that abuse is never the victim's fault. If you have made someone feel like they caused the abuse or they deserve what they are going through, you are perpetuating the stigma of blame. When I finally did tell my parents and I didn't get any reaction from them, I felt ashamed, like I had did something wrong. If you have made someone feel uncomfortable or embarrassed for sharing their story, you are perpetuating the stigma of shame. The stigma of labeling can look like a boyfriend calling you damaged goods after you shared your mental health challenges. A friend can deem you weak and desperate because you put up with an abusive boyfriend. A college professor or employer can deem you weak or incapable or unqualified because you shared the stressors that you are dealing with. These are just some of the labels that I have been given over the years. All of these labels negatively reaffirmed my already deteriorating self-image. Even today, I have to make an honest effort and try not to let the abuse, mental illness, and even others' opinions define and dictate my life. I need support, not the stigmatizing effects of blaming, shaming, and labeling. I will not be suffocated into silence by stigma. I'm here to give a voice to victims of abuse, share my tale of hope and how I live with mental illness, as well as share the personal effects stigma has played in my life. Some days it feels like I can't take one more step, but then I look back and see how far I've come. If you are struggling, please know that you're not alone. There may be dark days, but recovery is possible. I thank God that I'm here today as a survivor and not as a victim. I thank God for the compassionate people that He has placed in my life, for knowledgeable and caring counselors, therapists, and doctors, and most importantly, I thank God for giving you the courage to speak out and stop stigma. Thank you.
If you were to ask me today what life with a mental illness is like, I'd probably say 3 words. It goes on. It's as simple as that for me, but it wasn't always like that. My mom, she calls me her Romans 8:28 girl. She says that God uses all things for good, and growing up, never quite knew what that meant, never felt it could be possible or achieved. But lately, I think there's hope for that, and I see that hope, so it's there. My story with mental illness began when I was about 5 years old. It's not something that I clearly remember, but my parents told me that growing up, especially in kindergarten, first grade, that whole time frame, I would face a lot of anxiety related to cleaning and cleanliness, and especially before bed, because that's always a time when things come into your head. Before class, in the morning especially, I would be really anxious about what my room looked like. If everything wasn't in its exact place, its exact order, I would not be able to go to class. I remember very vaguely, but clear all in the same sense, that when I was very young, about 5 or so, it was the night before I was starting my first day of kindergarten, and I remember feeling so anxious, not because I was scared to meet the kids or because I was upset about the fact that I was starting school. It was just my room was messy. Things weren't in its right place, and I remember bursting into tears and telling my mom, I'm not gonna go, my room's not clean. And those signs reminded my mom of, or specifically my dad, of OCD, which he grew up with himself, and my grandpa and my great-grandpa. And so when I was about 9 years old, they decided to take me to my first therapy appointment. And I remember for a few months, it was very kind of just getting to know me. The therapist would ask me questions. Why do you do this? Why do you want your room like this? You know, how does that make you feel? And it's funny because at that age, when someone takes such an interest in you, it's this whole, wow, they really care. They really want to know this stuff about me, you know? I'm really special. And then in about January 2002, I remember I was at one of my therapy sessions and my mom and dad were called into the room, and my therapist told me, okay, you know, go sit in the waiting room for a little bit. I need to talk to your mom and dad. And so I just waited, and when they came out, I got my first label, obsessive compulsive disorder, commonly known as OCD. OCD never quite hit me to its full effect until I was about 10 or 11 years old. I'd say 10. I remember really thinking about sanitation specifically and contamination and how it was on my hands. Certain textures would really bother me. I remember rubber bands, and it's funny because my mom tells me even when I was like 2 or 3, I wouldn't touch her shoes. You know, some little girls, they'll play with their mom's shoes growing up. I didn't. I hated the smell, the feel of rubber and of anything like it, latex, anything. And I remember that as soon as the OCD kind of label was put on me, more focus came to these little quirks that I'd always seen as just that, little quirks, you know, I'm different, whatever. But I remember that my therapist and I started doing ERP, which is exposure response prevention. And it's a therapy where basically you expose yourself to what you're afraid of or what gives you anxiety. And then slowly you expose yourself more and more. Well, for a while, you know, it was just rubber bands was a huge thing that I didn't like. The texture, the feel, everything. I hated them. And I remember that when I went to therapy and she started saying, okay, you're going to look at a picture of a rubber band and then you're going to tell me exactly how it made you feel. And I would. And I remember getting up to a certain point, and then it was like, I couldn't go any further. She would touch a rubber band, try to shake my hand. Couldn't do it. She would tell me, go home, touch a rubber band, you know, tell me about that anxiety. And I couldn't do it. Basically, I wasn't willing to do the work, and I didn't want to do the work. And eventually, when I was about 10 and a half years old, one of my good friends at the time became the object of my OCD. And I think what was difficult, especially for me growing up, was that my OCD, even though it was labeled, it wasn't how people see OCD. They see it as just, you know, the hand washing. They see it as, you know, cracks in the sidewalk. They don't necessarily see it as you're asking your best friend at the time for reassurance that she is your friend, that she does care about you, especially when you're going through all this other stuff that's making you confused, such as, you know, this whole concept of OCD. So because of that, I started becoming increasingly more depressed. And so pretty soon I got my second label, which was major depressive disorder. And growing up with that, that's probably the time in my life that things were the hardest. I remember soon after I got that diagnosis, and again, it was very closely tied to my OCD, I began thinking about suicide. The first time I remember the thought of suicide crossing my head, I was about 10 years old. And I remember it was kind of like a weed. It popped up in my head, and before I knew it, it was out of control. And in many ways, it was my plan B. It was if things got too bad, if I couldn't control how I was feeling, then that'd be it. I could end it right there and then. So that summer, which was the summer of 2003, I was hospitalized for the first time. I remember I went to sports camp one day at my church, and I remember my best friend was there, the one that my OCD was kind of fixated on. And I remember asking her, do you care about me? Are you mad at me? Because she was hanging out with her other friends. And of course, if you're on the opposite end of that, if you're hearing, do you care about me? Are you upset every single day? That's gonna raise some eyebrows. It's gonna have some questions brought up in the mind of a 10-year-old friend of a girl with OCD. But I remember that night, I was so anxious, so overwhelmed that she was mad at me, so depressed, so out of control that I grabbed a bottle of the pills that I had that I just started taking, and I ran down the street and I screamed to my mom, I'm gonna do it, I'm gonna do it, I'm gonna take them all. And that night I was hospitalized for the first time. Hospitalization for me, in many ways, it kind of freed me. For once, I was surrounded by people who got it. I was surrounded by others who had other, now looking back, had other disorders or had other circumstances in their life that caused them to feel this way and to, get to this point in their life. And I wasn't alone. And that was such a freeing feeling, that it wasn't just me. And I was hospitalized 2 more times that summer. I was hospitalized again in 2008 and again in 2011, but that time was voluntary. And what I've learned about mental illness is that over time, you start to know yourself, or at least for me, I started to know myself, and I started to know what my triggers were. I started to know when I was getting those obsessive thoughts. And that was a huge part of my recovery, and being able to identify that, and even now being able to identify that. So that was a huge thing that kind of led me to what I do today. And it's funny because after my hospitalization in 2011, I didn't even really want to think about my mental illness anymore. I didn't want to think about either of them. I continued to have struggles with my relationships and with people that I cared about, mostly for the reason that OCD would be brought up. And once someone knows you have a mental illness, it's there in their head. That doesn't go away. They think every little offbeat thing that you do can be attributed to your illness. And it's like, well, at the time, especially, when I was in my teenage years, it's kind of like, well, I'm a normal teenage girl too. So OCD kind of made those thoughts be thoughts on steroids, or however you want to put it. And that was difficult. But a huge part of my recovery too is I actually did an internship at the Sacramento County morgue. For a while I was interested in biology, and biology was I was interested in the forensic side of biology. And so when I started at the morgue, I had all these dreams of, I'm going to go into forensic pathology, I'm going to go to med school, I'm going to, be this expert on dead people, which is, morbid and all that stuff that people already think. But when I actually got there, I started picking up on this pattern. And the pattern was that there were a lot of people in Sacramento County who committed suicide. And I remember the first time I ever saw someone lying on the gurney in front of me who had died by suicide, I fought so hard not to let it affect me. I tried so hard to just push it in the back of my head, and I realized I'm the only one in this room that knows what's going on inside me. But I remember just looking at them, and after I started to see that pattern, after more people I'd see week after week committing suicide, and I'd have to work on them, autopsies. You can take that part out if it's too morbid. I started realizing that this pattern needs to be stopped. And I realized this could have been me. This person could have been me. And that was a thought that hadn't crossed my mind when I was actually going through feeling suicidal, when I was actually going through my mental illness. So once I started seeing this pattern emerging in the morgue, I realized something had to be done. Clearly it was an issue that not just I had dealt with, and until then I didn't really see that. I didn't really see to a larger extent the bigger picture that this is a problem in society. And after I saw this in the internship that I had at the morgue, I remember I was seeing a counselor at the time over at CAPS on Sac State's campus, and I remember asking her, like, what can I do? What on campus can I do? Something involved with mental health, something involved with anything. I just wanted to get more involved. I think the morgue kind of sparked something in me that I really needed to give back, that there was something I had to do. And I just had this feeling of, I want to give, I want to help. And then my supervisor, who's now my mentor, she told me about Stop Stigma Sacramento, and she told me about their Speakers Bureau. I think one of the biggest rewards of being part of the Speakers Bureau is knowing that I have helped people, even it's that whole delayed gratification. You never know who you're helping. And the thing is that everyone knows someone. You know, everyone has, whether it be themselves, whether they have a mother, brother, sister, you know, cousin, significant other. 1 in 4 people have a mental illness, and that's something that speaks volume to what I do, because I know that I'm touching those 1 in 4s, just like I'm the 1 in 4. And that's very rewarding to me. In terms of what it's done for me personally and how it's helped me and how telling my story has helped me, I got a really great scholarship my senior year of college, undergrad, because of telling my story. I've been to tons of conferences, tons of trainings. I've gotten to speak at the American Foundation for Suicide Prevention Walk in front of over 1,000 people. It's opened up so many doors, and it's shaped who I am, honestly. You know, I started off as this person in biology who didn't know what the heck I was doing, who didn't know where I was going. I knew what I wanted, but did I really? And now I have this clear set path, and I'm currently in my first year of graduate school at Sac State in the social work program, and I hope to pursue mental health policy. I hope to change things in a larger level. And looking back, I've always seen things in that larger level. Even when I worked at the morgue, seeing one person on the gurney, that I knew that there was something else out there that needed to be addressed. So in a sense, I think that telling my story has been not only therapeutic for me, but it's also helped so many other people. And to me, that means more than anything. And like I said, my mom always calls me her Romans 8:28 girl. And I think not only can I use all this stuff for good and for God's glory, but I can change a whole heck of a lot of lives in the process. So my name is Katie Williams. I'm a first-year grad student at Sac State. I'm living with a mental illness, and all I have to say is, so what?
Good evening. My name is Roman Montague, and welcome to my home. This is my family. These are my children.
My name is Roman Clifford Cub Montague.
My name is Avonlea Cobzet Montague.
My name is Cimarron Robert D'Artagnan Montague.
To begin my story and to share my story, had a great marriage. For the first 10 years, everything was wonderful. Everything was great. Did well. Started off with three children. We were happy. Had a business. It was going well. And then there were some events that took place, some tragedies that took place in her life. She came home from an appointment once. She told me that she had talked with the doctor and he'd given her antidepressants. And I didn't know that she was depressed, but she said she felt a whole lot better with the antidepressants. I remember thinking, well, that's kind of weird. Didn't think much about it. Sometime later, she came home after visiting with the doctor. She said the doctor had given her some anti-anxiety medication, which kind of surprised me because I didn't know that there was an anxiety issue. As we had talked, she told me that she'd been anxious for many years prior to me knowing her, but those symptoms had subsided, so it was never really an issue. But with the events that took place, those symptoms had increased, and so her level of depression and anxiety increased. By way of background, I myself am a licensed clinical social worker and a marriage and family therapist and mental health clinician. That's my background. Even though I had that knowledge and I had that experience, I was completely caught off guard and didn't recognize it within my own home and within my own marriage. So from that point forward, for the next 15 years, her mental health continued to deteriorate. She became more and more limited in her ability to function as a wife, as a mother, as a person. Eventually, she had pretty much isolated and secluded herself just to the bedroom. So her entire world shrank more and more and more. And these children were all quite young at the time when this deterioration really began. I think Cimarron was maybe a year old, and these two here were like 5 and 6 years of age. And so I would plead and beg with her to help with cooking meals for the kids, help with cleaning the house, help with paying the bills, help in just any number of ways. And she just wasn't able to, couldn't do it, and I felt the stress and the pressure build, and it was very difficult for me as well. She continued to seek help, medication, and she was taking it by the handfuls. It was all prescribed, and she was taking it as prescribed because I would check the medication and look. I would encourage her to invite me to go to appointments with her physician so I could give them feedback, which might in turn help them, but she wasn't willing to have me be part of that. She was kind of concerned that I might say something that would make her feel bad about herself or be difficult and challenging. The summer of 2011, she took a dramatic change for the worse. She deteriorated even more rapidly to the point to where she was hearing voices from people who weren't there, talked about relationships with people that didn't exist that she didn't know. The result was she had to be hospitalized against her will, which was a very terrible experience for her. When she came out of that hospitalization, she was traumatized by it, didn't want to go back, but her mental health, her mental status didn't change. And she continued to deteriorate to the point that she attempted suicide. She was hospitalized again for that event. Ultimately, she was released from the hospital, and I think that she had made the decision that the hospital was such a terrible experience for her that she was never going to go back. So she decided that the next time that she attempted suicide, she was going to make sure she was successful. In November of 2011, I remember going with her to her psychiatrist, and the psychiatrist asking her the appropriate question, do you have any intention or any plan to harm yourself? And her reply to the physician was, not at this time. And I interpreted that as, oh no, that's not good. Not at this time is not the same as no. That just means not right this second. So I was pretty worried and concerned. Probably one of the biggest regrets that I had is that when I went back into work a few days later, one of the women at the front desk asked me how my wife was. And I commented to her that I think it's just a case of time before she commits suicide. And I regret that because that was an honest thought that I had, but it was kind of a stunning comment for somebody to hear. Within a month, that in fact is exactly what had happened. I know for me, it's made me a much better therapist, a much better counselor, a much more empathetic, compassionate, sensitive father and man and professional. I continue to work in my profession as a therapist and a counselor, working with both victims and perpetrators of violence and abuse, and the opportunity that I've been given to be able to be part of the Speakers Bureau and go out into the community and to the schools and to different agencies and organizations and share my story and our story of mental illness, and to know the numbers of people in society that suffer, oftentimes unsupported or in silence for fear of how they're going to be perceived, or since mental illness isn't something that shows up as a physical deformity, that they're going to be treated as if they're a lesser person or a lesser human being. So my desire is to be to normalize that it's there, to bring it out in the open so there's discussion, there's communication, to give people a sense of hope, not just for themselves if they're living with it, but to give love and hope and support to family members or to friends or neighbors or people that they come in contact with, to let them know that everybody's worthy of dignity and respect, and that we're all children of God and He loves us and He's there for us, and that's a significant part of our lives.
So my name is Roman, and I am my mother's son, obviously. I guess I never really knew the mom that my dad talks about. So, for example, like how my dad was talking about how he met my mom, and she was like this witty person apparently who had wanted nothing to do with him, and had these little smirks like, get away from me, I want nothing to do with you. And I often hear my dad talking about my mom for the years before I was even born, and you sit there and you think, like, I remember when I was a kid, I was like, I don't know this woman. The mom that I knew was the mom that, stayed in bed all day, and the mom that, I wouldn't see for days at a time. I remember speaking at her funeral, and I still think this today, that I think my mom did the best she could with the cards that she was dealt. I don't think that she ever did any of that to hurt us, or, she didn't do it with any malicious intent, obviously. But growing up, I didn't understand that. I didn't understand why, when I'd come home from school, like there wouldn't be dinner on the table, or I would come home from school and the house would be a mess. And I think for a long time, even when that was happening, I was too young to even understand that wasn't normal. So I wasn't even getting mad then. And it wasn't until probably when I started getting older, like in elementary school, and I started going to like my friends' houses and like seeing the mom. And I have one friend in particular who I was at their house all the time growing up, and like his mom was always like laughing and joking around, and the family would be, every day after school they'd all be together eating dinner and watching TV or just messing around. And it wasn't until then that I started kind of realizing that, something is definitely not right, at my house. And again, as I got older, I started really resenting my mom for that and getting really angry with her all the time. And I think that she always looked at it as like, why is my son being so mean to me all the time? And I always looked at it as like, why is my mom neglecting me all the time? And there'd be moments of like where I would, our relationship would be better. From like probably 17 or 18 is when I kind of got older and I started maybe recognizing a little bit what was going on. Not really having a full understanding of what she was struggling with, but realizing that like obviously like what she's doing isn't going to get fixed because she's been doing this my whole life. It's just funny looking back now. That was when I was, and that was when I moved out when I was in my early 20s. So even in my early 20s, I still didn't fully understand that like she wasn't doing this to me. It was happening to her, and it just, as me living there, I just happened to be exposed to that. And it's hard when you see someone like that, when there isn't anyone trying to hurt her, but she's absolutely convinced that someone is. And there's nothing that you can do for her. I mean, one of the last times I saw her alive actually was right before her actual suicide attempt that was successful. And I remember she was over there feeding the birds. And I remember actually talking with her because I realized at this point it was futile to be angry at her anymore. It was futile to even, be mad. And so I actually talked with her, and I asked her, just please forgive me for how I had acted when I was younger. And I remember giving her a hug. And of course at that time she wasn't, I don't even know if she heard that. She was so, I don't know if incoherent is the word. I mean, she was alert. She was walking around and doing things, but I don't know if she actually heard that. But that was actually the last thing that I had said to her.
My story is pretty different than my brother's and my dad's. I think more than any of them, I was there for most of it. There on December 23rd. I remember 6:12 in the morning, she came in my room. So I heard my door quietly open, and I was kind of like, what are you doing? She was like, oh, just give me a hug. 2 hours later, so it was probably after 8, I just heard this thud. So I got up thinking, oh, maybe just someone knocked something off, a counter, or the cat pushed something off, and, so I was very calm still, because I felt like if I let myself freak out, then it was me admitting there was something to freak out about. I walked in her room, and she was laying on the bed, and she kind of had her head propped up on one hand. And I was like, oh, well, what was that? Is everything okay? And she's like, yeah, everything's fine. Don't worry about it. And so just kind of looking at her. And I realized, like, when she had her head propped up, she had like a T-shirt on her hand. And I noticed it had some blood spots on it. So I was just like, that was you that fell. That's what that sound was. And she had hit her head. And then she started talking kind of funny. And I was like, Mom, are you okay? And I reached out my hand for her to stand up. And I said, one way or the other, I'm going to take you to the hospital if you have a concussion or something. And so I reached my hand out to her and to help her stand up. She tried to stand up and couldn't, so she just sat back down. So again, I had my phone ready to call 911, so I did that. And the 911 operator had me ask her a couple questions, and she didn't really respond to me. Her mental illness has just morphed into this monster that, it was so quick. And this whole time, I remember I remained really calm. I was even able to tell her, like, hey, I'm calling from a cell phone. It's going to pick up the tower in this other city where we bought the cell phone, and that's not where I'm at. I'm here. And she said, okay, you know, that everyone's on their way. I had her on the gurney on the floor with, you know, an oxygen mask and all those little electrode things hooked up. The first time this happened, I had a noticeable feeling that said, she's okay. The second time it happened, I had no feeling. I had no comfort. I didn't know that, you know, I didn't know she was gonna die. And that concerned me. And the doctor had told me, you know, she wants to see you. So I went in there and, you know, I held her hand. You know, I was trying to talk to her, you know, like, how you feeling? She wouldn't answer me. I just remember I held her hand and she squeezed it. And in that moment, it was kind of like she was able to communicate many things to me through that squeezing my hand. I started crying. Because the mom I had known was gone, and that was kind of like her physically touching, like us physically touching was a way of like reconnecting her world and my world. And I didn't feel scared, and that's what's weird to me. I didn't feel worried, but I think I was crying for that girl that I was that had to go through this for months and months and months. So I remember I just was crying into my dad's chest. And I remember looking back at my mom when she was alive, and I was just like, I could very well be looking at the last time I ever see her alive. You know, when we let her go, I've even thought about it, whereas I think like we kind of walked her, you know, to the end of mortality, so to speak.
When I was younger, she was my mom and my friend. And when I was like maybe 8 or 9 years old, we'd be like little pen pals, write letters to each other, sing on their door, and we'd read it, go back and do it again. So yeah, my mom was my friend when I was a little kid. As I got older, you know, I could tell there wasn't something always right about her, because when I got older, I started going to friends' houses. Their moms would interact with me, their kids, the father that was there. They'd make dinner. They'd yell at their kids a little bit when they did something stupid, like I never got really. And it was an interesting experience for me, because when I got older, I also realized my mom just laid in bed all day, every day, probably 22 hours of the day. Never saw her unless I came to her, because she never came to me ever. She'd be an hour late picking me up from school every day because she couldn't get out of the house ever. Never had friends over. Just nothing like that at all. And I've always been pretty jealous of friends having really good moms. Even today, I still get really jealous by it. Because, I mean, I miss having my mom a lot, even if she wasn't always there. I'd say when I was 14 years old, like, I myself have a mental illness. I literally inherited it from my mom with the depression, anxiety, and all that fun lingo. And I remember when I was that age, she told me that when she looked in my eyes, she said I looked dead because of how depressed I was. And, you know, coming to the last few years of her life, I looked in her eyes and thought the same thing about her. It was just like, she wasn't the same person that I knew. Any remnants of herself that she had left were gone. It was really hard for me when she died too, because even though I'd distanced myself from her for so long, and I tried to cut those bonds with her I tried so hard to, I never could, because she was always the friend I always had at home. I also remember, like, after she had died, I went on like a trip with like a church thing. I walked 20 miles for it. And I remember thinking to myself, because I was not prepared to do that. I was wearing the wrong shoes, and it was just really bad. You never go to 20-mile hike in 3 days in like Vans. That was a bad idea.
Those are bad shoes in general.
But anyway, like, on the first day, I had blisters that went across the entire balls of my toes. I still had another 12 miles to do like that, and it was unbearable. So by the third day, last like 2 miles, I was thinking or asking my mom if she could help me in any way I could. And in that moment, just an overwhelming just sensation of just like, you can do this. You're a strong kid. I'm here for you and I love you. And it's just like, that's the strongest feeling I've ever had in my life when it comes to love for my mom. I was able to finish it. I didn't give up, no matter how much I wanted to, because I didn't want to disappoint my mom. And I try really hard to make her as happy as I can, even if she's not here to see it. So I don't even want to disappoint her memory at all.
I'm so proud of them, how they've managed all this. When you're an adolescent or a young adult, there's a lot of transitional life experiences happening away with college and high school and relationships and boyfriends and girlfriends, and just all that, and what do you want to be and what are you trying to do. And to be in school, it's really hard to focus when you have these, but they have all, each of them, have just pressed forward, knowing that this has impacted their life, but it hasn't defined their life. If anything, it's refined their life. And my name is Robert S. Roman Montague. This is my family, and this is our story.
Thank you for tuning in to Mental Health Matters. And if you would like more information on the Sacramento Speakers Bureau, please visit stopstigmasacramento.org. And we would like to offer special thanks to Bill, Kamika, Katie, and Roman for sharing their stories, as your mental health does matter.
When I think of where I've been, the good times and the bad, on a scale of 1 to 10, either way I'm glad, 'cause I'm not alone. As I'm reaching for the phone, your voice is there, you really care, you're my comfort zone. Sometimes when I'm lost, crushed beneath the pain, though I can't afford the cost, I just smile and play the game. But there's a healing place where I cannot pretend. Your smiling face, your heart's embrace heals me again. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song, and I simply can't deny that I'm not alone. 10,000 times I've known my best bet is that first step for